The dismissal came during Mom's annual New Year's Eve party, right after Uncle Charles finished toasting to family success stories, and conveniently skipped over me entirely. Sarah's been having some minor health issues, Mom explained to her gathered friends, waving her champagne glass dismissively. Nothing serious. You know how young people can be dramatic about doctor visits. I stood in the corner of the living room, watching 30 relatives and family friends celebrate while discussing my minor health issues. What they called minor was actually stage 3 Hodgkin's lymphoma that I'd been fighting for 8 months, including aggressive chemotherapy treatments that had left me bald, exhausted and immunocompromised. The important thing, Dad added, joining the conversation with his characteristic authority, is not letting medical anxiety take over your life. Sarah's learning that lesson. At 26, I'd been the family's overlooked daughter for most of my adult life. While my brother Michael earned praise for his marketing career and my sister Jessica got attention for her Instagram influencer status, I was just Sarah, the quiet one who worked with sick people and apparently invented health problems for attention. Poor Sarah's missed so many family events this year, Aunt Linda said sympathetically. Always some doctor appointment or treatment schedule to work around. Exactly, Mom agreed. We've had to plan around her medical drama constantly. Thank goodness we didn't let it ruin tonight's celebration. My medical drama had included 6 months of intensive chemotherapy, 2 hospitalizations for severe infections, and radiation treatments that required isolation periods to protect my compromised immune system. The family had continued their social calendar throughout, occasionally expressing mild irritation when my treatment schedule conflicted with their plans. What exactly does Sarah do for work? Mrs. Henderson from next door asked. Something medical related, right? She works at the hospital, Jessica answered vaguely. Some kind of nursing or therapy thing. Very hands-on with patients. I looked at my sister who'd never bothered to ask about my actual job beyond knowing it involved healthcare. To them, I was just Sarah the hospital worker who had inconvenient medical appointments and lived modestly in a small apartment. My phone buzzed with an encrypted message. Dr. Patterson, New Year's broadcast confirmed for 11 p.m. Eastern Standard Time. CDC coordination complete. Surgeon General Hayes will reference your research directly. Are you ready for national exposure? I checked the time. 10:45 p.m. The thing was, my family had no idea that their dramatic daughter with minor health issues was Dr. Sarah Patterson, Chief of Infectious Disease Research at the National Center for Disease Control. They also had no idea that my minor health issues represented a breakthrough case study that was about to change national health policy. Sarah does look tired tonight, Uncle Charles observed. All that medical fuss must be exhausting. The doctors keep running tests, Dad said with slight annoyance. Everything comes back normal, but they keep finding reasons for more appointments. Actually, nothing had come back normal. My lymphoma had presented with unusual characteristics that had puzzled oncologists nationwide. What my family saw as medical drama was actually a complex case that had attracted attention from the CDC, National Institutes of Health, and several international research institutions. Well, Mom concluded to her friends, we're not letting Sarah's health anxiety dominate family events anymore. Life goes on. Michael raised his glass. Here's to not letting medical paranoia control our lives. The room toasted enthusiastically while I quietly checked my secure CDC communications. In 15 minutes, the Surgeon General would address the nation about emerging infectious disease patterns, using my case as a primary example of why family support systems needed better education about serious medical conditions. My family was about to discover that my minor health issues had become a matter of national health security. The family continued their celebration while I retreated to the kitchen, ostensibly to help with refreshments but actually to monitor my secure communications. My research had uncovered a dangerous connection between certain lymphoma presentations and emerging infectious disease patterns that posed significant public health risks. 4 months while my family dismissed my condition as health anxiety, I'd been working with federal health agencies to document and analyze my case. The unusual progression of my lymphoma had revealed a previously unknown viral component that could potentially affect thousands of people. My colleague at the CDC, Dr. James Morrison, sent another encrypted update. Sarah, the President's Health Advisory Team has approved emergency protocols based on your research. Your family case study demonstrates exactly the kind of dangerous dismissal patterns we need to address publicly. The irony wasn't lost on me. While my own family minimized my health struggles, federal health authorities were treating my case as a national priority. "Sarah's always on that phone," Jessica commented to her friends. "Probably texting her doctors again. She really needs to learn to disconnect from medical stuff," Michael added. "It's not healthy to be so focused on illness." Actually, my focus on illness had led to breakthrough research that would potentially save thousands of lives. But my family had spent 8 months treating my work as an obsession and my genuine health crisis as attention-seeking behavior. My phone rang. Dr. Elizabeth Hayes, the Surgeon General, calling directly. I stepped into Mom's home office for privacy. "Sarah, are you ready for tonight's broadcast? Your case study is going to be the centerpiece of our new family education initiative." "Ready as I can be, Dr. Hayes. My family has no idea what's coming." "That's actually perfect for our purposes. Their dismissive response to your condition exemplifies exactly the dangerous family dynamics we need to address. When I reference your case tonight, it's going to highlight how families can unknowingly endanger patients by minimizing serious medical conditions. They still think I work as a hospital technician or something." "Sarah, you're the youngest chief of infectious disease research in CDC history. Your discovery about the viral lymphoma connection has revolutionary implications for cancer treatment and epidemic prevention. Your family's ignorance about your professional status makes this case study even more powerful." Through the office window, I could see my family laughing and celebrating, completely unaware that their dramatic family member was about to be featured in a national health broadcast addressing the exact behavior they demonstrated all year. "Dr. Hayes, what should I expect after the broadcast?" "Media attention, definitely. Your research will become public knowledge, which means your professional identity will be exposed. Are you prepared for your family to learn who you really are?" "I've been prepared for months. They never bothered to ask." "Sarah, your work this year while battling your own illness has been extraordinary. You've continued breakthrough research while undergoing aggressive treatment. That kind of dedication to public health is remarkable." After ending the call, I returned to the party where the family was debating whether to watch the traditional New Year's countdown or switch to something more entertaining. "Sarah," Mom called out, "you missed the toast to Michael's promotion. Come celebrate with the family instead of hiding on medical calls." "Actually," I said, "I think everyone should watch the Surgeon General's New Year's address. It starts in 5 minutes. "Boring," Jessica groaned. "Who watches government medical stuff on New Year's Eve?" Dad shook his head. "Sarah, your medical obsession is getting out of hand. We're trying to celebrate, not worry about diseases and health scares." "Trust me," I said, "this broadcast will be interesting for everyone." At exactly 11 p.m., I turned on the television and switched to the CDC's New Year's health broadcast. The Surgeon General appeared on screen, looking serious and authoritative. "Good evening. I'm Dr. Elizabeth Hayes, Surgeon General of the United States. Tonight, I want to address a critical public health issue that affects families across America." The room quieted slightly, though several relatives continued chatting. "Tonight, I want to discuss the dangerous phenomenon of family dismissal of serious medical conditions, using a case study that exemplifies how even well-meaning families can inadvertently endanger their loved ones." Mom glanced at me. "Sarah, this seems like something you'd find interesting." Dr. Hayes continued on screen. 6 months ago, our research team identified a breakthrough case involving a young woman whose family consistently minimized her serious health condition. This patient, Dr. Sarah Patterson, Chief of Infectious Disease Research at the CDC, was diagnosed with an unusual form of lymphoma while simultaneously conducting groundbreaking research on viral cancer connections. Complete silence filled the living room. "Dr. Patterson?" Mom repeated weakly. On screen, Dr. Hayes displayed a professional photo of me in my CDC laboratory coat. Dr. Patterson represents a troubling pattern we've identified nationwide. Medical professionals whose own families dismiss their health concerns, creating dangerous delays in treatment and support. That's Sarah," Jessica whispered. "While battling stage 3 Hodgkin's lymphoma," Dr. Hayes continued, Dr. Patterson continued her research into infectious disease patterns, discovering a previously unknown viral component that has revolutionary implications for cancer treatment and epidemic prevention. Dad stared at the television, then at me. Sarah, is that really you? Dr. Patterson's case is particularly significant because her family's dismissive response to her condition, referring to aggressive cancer treatment as medical drama and health anxiety, represents exactly the kind of dangerous family dynamics that can worsen patient outcomes. Mom's champagne glass slipped from her hand. Furthermore, Dr. Patterson's family was unaware of her professional status as one of the nation's leading infectious disease researchers. This ignorance about her expertise compounded their dismissal of her legitimate health concerns. Michael looked like he was having trouble processing the information. Sarah's CDC researcher. On screen, Dr. Hayes displayed charts and graphs. Dr. Patterson's research, conducted while undergoing chemotherapy, has identified viral markers that could predict cancer development in high-risk populations. Her work will likely prevent thousands of cancer deaths annually. The irony, Dr. Hayes continued with obvious emphasis, is that while Dr. Patterson's family dismissed her health struggles as minor issues, federal health agencies were treating her case as a national research priority. Aunt Linda looked confused. Sarah, you work for the federal government? Dr. Patterson exemplifies the resilience required of medical researchers, the Surgeon General said. Despite lacking family support for her health battle, she continued breakthrough research that will benefit millions of Americans. The broadcast cut to footage of me presenting research findings at a medical conference, clearly identified as Dr. Sarah Patterson, Chief of Infectious Disease Research, CDC. Oh my God, Jessica said. Sarah, you're famous in the medical community? Dr. Hayes addressed the camera directly. Dr. Patterson's case demonstrates why families must take medical concerns seriously, especially when raised by healthcare professionals. Family dismissal of serious conditions can have tragic consequences. As the screen faded to black, the living room remained silent for several minutes. Finally, Dad spoke. Sarah, we had no idea. You're a federal health official. I'm Chief of Infectious Disease Research for the CDC. My minor health issues represent a breakthrough case that's changing national health policy. But why didn't you tell us? Mom asked desperately. Because you spent 8 months calling my legitimate health crisis medical drama, without ever asking what my expertise actually involved. The media attention began within hours of the broadcast. By morning, my phone was flooded with interview requests from major news networks wanting to discuss both my research breakthroughs and the family dynamics highlighted by the Surgeon General. My research on viral lymphoma connections became front-page news in medical journals. The discovery that my own cancer had led to breakthrough insights for preventing thousands of future cases made national headlines. The family's reaction was complex. Shame mixed with pride, embarrassment about their dismissive behavior combined with excitement about having a famous relative. Sarah, Michael called the next morning. CNN wants to interview the whole family. Should I say yes? Are you prepared to discuss how you toasted to not letting medical paranoia control our lives while I was undergoing cancer treatment? 3 months later, my research led to the development of new screening protocols that could identify high-risk patients before cancer development. The Patterson protocol became standard practice at major medical centers nationwide. The family attended the White House ceremony where I received the Presidential Medal for Medical Excellence, but the recognition felt hollow. Their pride was based on external validation rather than support during my actual health crisis. My cancer entered full remission, aided by treatment protocols I'd helped develop through my own research. The viral component I'd identified led to targeted therapies that improved outcomes for thousands of patients. The Surgeon General's broadcast became required viewing in medical schools as an example of how family dynamics can impact patient outcomes. My case study was used to train healthcare providers about recognizing family dismissal patterns. I continued my research at the CDC, now with additional resources and national recognition. My work expanded globally, with international health organizations implementing protocols based on my discoveries. But the family relationships remained strained. Their newfound respect was based on professional fame rather than understanding of who I'd been throughout my health struggle. Sometimes the validation you wanted arrives too late to heal the damage caused by dismissal. The family that dismissed my minor health issues, now bragged about their famous daughter, but they'd missed their opportunity to support me when it mattered. My research continued saving lives worldwide, but the recognition that would have meant most was simple acknowledgement that my health crisis was real and deserved their concern.